Dear viewers, I hope you are all fine. This ultrasound video shows a case of appendicular abscess. An appendicular abscess is a condition in which an abscess is formed around the appendix as a result of appendicial perforation or extension of inflammation to the adjacent tissue due to aggravation of appendicitis. It occurs in 2 to 6% of patients with appendicitis. An appendiceal mass is an inflammatory mass consisting of inflamed appendix, its adjacent viscera, and the greater omentum, whereas an abscess is a pus-containing appendicial mass. The patient may be diagnosed by physical examination, computerized tomography, CT scan, and ultrasound. Now you can see a large abscess is seen in the right iliac fossa, and the abscess is seen in the superior portion of the inflamed appendix. Normally you have to trace the acute appendicitis, but abscess is easily seen in the right iliac fossa, and you can search for the appendix in the adjacent gut loops. Sonographic criteria of diagnosis of appendicitis include a tubular structure that is more than 6 mm in diameter, noncompressible, and lacks peristalsis. You can see this is the cecum, and the abscess lies just superior and parallel to this cecum region. And in the caudal portion of the abscess, this is the inflamed appendix. But as it looks like that fluid has leaked from the inflamed appendix, so its size has slightly decreased. You can see the measurement of the appendix, and it measures 4.7 centimeter into 8 millimeter. Now you can see both the abscess and the inflamed appendix. You can see the fluid in the abscess is thick and turbid, having multiple internal echoes. One of the most common complications following appendectomy is infection. Around 20% of people who have ruptured appendix develop an abscess, that is ball of pus, within the abdominal cavity about 2 weeks or so after appendectomy. These abscesses must be drained surgically, but this abscess is lying before the surgery. A small skin abscess may drain naturally or simply shrink, dry up, and disappear without any treatment. However, larger abscesses may need to be treated with antibiotics to clear the infection, and pus may need to be drained. Sometimes abscess forms around a burst appendix. This is painful collection of pus that forms when the body tries to fight the infection. In rare cases, that is 1 out of 500, an abscess can form as a complication of surgery to remove the appendix. Now you can see both the inflamed appendix and the abscess. The difference between phlegmon and abscess is as follows. A phlegmon is unbounded and can keep spreading out along connective tissue and muscle fiber. An abscess is walled in and is confined to the area of the infection. Now again you can see both the inflamed appendix, and this is the communication through which the pus has leaked out of the inflamed appendix. The abscess can be treated with antibiotics, drainage of pus, or both. At first, the patient will likely receive care in the hospital. The antibiotics are given to treat the abscess. You will take them for about 4 to 6 weeks. If left untreated, the abscess may spread to the brain or spinal cord. The abscess is large, has not healed within 2 weeks, and you will have to suffer from fever. As far as the normal appendix is concerned, it is compressible tubular structure with the blind end. It is generally accepted that normal appendix doesn't exceed 6 millimeter in maximal outer diameter, which is the most important diagnostic criteria to exclude acute appendicitis. Again, you can see the tracing of this appendix. Appendicular abscess is defined as a collection of pus resulting from necrosis of the tissue superimposed with infection in an inflamed appendix. It is unusual and rare entity. Appendicular abscess is life-threatening complication of acute appendicitis, preoperatively or appendectomy, or after appendectomy postoperatively. So the abscess is a pus-filled infection in the body tissue. It is usually caused by bacteria, but can also be the result of viruses, parasites, or swallowed objects. Ultrasound is the first investigation advised to evaluate a suspected appendicular pathology. Findings of an appendicular abscess include fluid collection, hypoechoic in the appendicular region, which may be a well circumscribed and rounded, or ill-defined and irregular in appearance. Appendicular lump is well-known sequelae of acute appendicitis encountered in 2 to 6% of patients. Successful management of appendicular lump is controversial with different approaches, as many controversies are arising regarding management of appendicular lump. Now, the differential diagnosis of appendicitis in a young woman: acute gynecological diseases such as ovarian torsion, hemorrhagic ovarian cyst, pelvic inflammatory disease, and ectopic pregnancy should also be considered within the differential diagnosis. Again, you can see the inflamed appendix and the abscess. Now, the lump formation after acute appendicitis is a result of walled of perforation of appendix. Lump can be inflammatory mass consisting of inflamed appendix, adjacent viscera, and greater omentum, or a pus-containing appendicular mass. You can see again the communication between the abscess and the appendix, inflamed appendix. But the abscess seems to be round to oval in shape. The antibiotic used for appendicitis, particularly cifoton and cefotaxime, help prevent wound infection after surgery. Other antibiotics used for appendicitis include piperacillin and tazobactam, ampicillin and sulbactam combination. However, the patient may not feel better for 2 to 3 days. How quickly the patient gets better after antibiotic treatment varies. It also depends on the type of infection the patient is having and intensity of the infection and the antibiotic used. Most antibiotics should be taken for 7 to 14 weeks. Again, you can see the appendix and the appendicular abscess. In this case, the abscess seems to be sealed off. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.